For April 29th, 2020, what's going on with COVID-19 in New Mexico? Let's talk about that. This is a logarithmic scale. It goes 1, 10, 100. It lets us see changes both in very small numbers and very large numbers. We stand at 3,213 cases, 110 deaths. On March 19th and 23rd, the public health orders designed to slow the spread of infection went into effect. This red dotted line shows the exponential rise that would have occurred based on the cases that happened prior to the public health orders. The blue dotted lines show a very rough estimate of how many cases we might see by May 9th. The case fatality rate divides the number of deaths by the number of cases. This graph shows the case fatality rate over time for New Mexico. Our current case fatality rate is approximately 3.7%. To put this in perspective, the CDC estimates that the national case fatality rate is about 5.6%. Seasonal flu has a case fatality of only 0.1%. Case fatality varies widely across the country. Michigan has the highest rate at this time, with 8%. The 2-week offset case fatality rate looks at the total number of deaths today compared with total number of cases 2 weeks earlier. This is because on average it takes about 2 weeks before a case will resolve either to recovery or death. That number is about 7.8%. If we look at cases that are no longer active, we can divide them into those who have recovered and those who have died. About 86% have recovered and 14% have died. This graph shows the age distribution of people who have tested positive for COVID-19. Infection occurs in all age ranges. New Mexico's ethnic groups have been affected differently. While Native Americans make up 11% of our population, they currently make up 50% of COVID-19 cases. No group is spared from the possibility of dying from COVID-19. 1 out of 5 deaths occur in those under 60. However, 80% of deaths occur in people over the age of 60, particularly those in their 70s, 80s, and 90s. The Department of Health reports that 90% of people who died either had ongoing medical problems or lived in long-term care facilities such as nursing homes. People with diabetes, obesity, or high blood pressure tend to do poorly if they get infected and become critically ill. There are a number of sophisticated ways in which epidemiologists and others try to assess whether the epidemic is getting less severe. These include complex calculations, such as the effective reproductive ratio and doubling time. It can be challenging to find these measures readily available, and they're usually not produced on a daily basis. So let's see if we can find a simple measure to give us a clue as to whether the epidemic is getting better. In this graph, the blue dots are new cases per day. The orange line is the 7-day moving average. In other words, it takes the average of the previous 7 days. While there was a period in which it stalled, it appears now to continue on its rise. In other words, we are still getting more cases per day now than we did in the past. So what might it look like if things were getting better? Well, this is a hypothetical graph, but I think if we began to see new cases per day start to fall, we could be reasonably confident that things were getting better. Well, that's it for now. Feel free to check out my other videos where I try to simplify the confusing world of COVID-19. Thanks for watching.